Thank you, Sandra. Hello, everyone. I'm excited to be here back in Michigan, which is where my roots are. I'm a Youper. Unlike all of you below the bridge who are trolls. And this is where my home is and where my heart is, so I'm back from Baltimore. And I'm here today to tell you a bit about my story and my journey in the hopes that you can learn something for your own companies or your own journeys with the theme of that there is no silver bullet. So I myself, at my core, I am an entrepreneur. But this hasn't always been the case. I think the theme of if you haven't seen it, you can't be it, rang true for me. My beginning of my entrepreneurial journey, I remember my freshman year of college, walking into the Center for Entrepreneurship, much like the Innovation Center here at Western Michigan University. I remember tapping my foot, and I couldn't wait to get out of there. I thought that entrepreneurship was just, white boys in hoodies building apps and out there just to make money. And over time, I realized that in building a company or building a club or building your entrepreneurial journeys, it's about creating value. And it doesn't matter if you have a great idea if it never gets out there in the world and actually has that true impact. And that's what I've done through my company, Sisu Global, that I'll tell you about, but also throughout my entrepreneurial journey, through my first company, Centricycle, and some of those learnings as well. And the core behind everything I've done is Sisu. That's the name of my company. It's Finnish. It means persevering in the face of adversity. And this is a core tenet of my company, a core tenet of myself, and a core tenet of being an entrepreneur, as many of you know. So Sisu, as my organization, to tell you where I am today, is an organization focused on increasing access to blood. Across the globe, when a clinician reaches for a blood bag, it isn't there. So if a patient comes in with trauma and internal bleeding, what can a doctor do? Well, one option, often the only option, if there is no donor blood, is to actually capture that blood, filter it, and give it back to the same patient in the same surgery so they don't need someone else's, through that process of autotransfusion. This is something that can address the global shortage of 100 million units of blood each year, especially in emerging markets and the military. And this is common sense. Your own blood is better than someone else's. I don't need to cite scientific studies and research to back that up. And we do this process in the United States, especially with Jehovah's Witness, and especially in, say, cardiac surgeries, but it doesn't reach emerging markets. And so what inspired the creation of this company was observing what really innovative clinicians around the globe do instead, which is it's equivalent if you don't have a hammer, if you're building a bookshelf, if you don't have a tool when you're trying to perform surgery and retransfuse blood, clinicians can even use a scoop or a soup ladle to scoop out blood, filter it through gauze, and retransfuse it back to the same patient. And why is this? It's not because there isn't enough money there in the ecosystem. Blood costs $100 per blood bag. It's being paid all around the globe. Here in the United States, we pay $250 to make sure a unit of blood is safe in order from the Red Cross to retransfuse it. But that technology to retransfuse a patient's own blood, or that alternative, isn't reaching much of the world. And why is that? Well, diving deeper, 80% of the world's medical devices are designed for 10% of the world's population, meaning that medical devices are designed for the US and Europe, but they're not designed for much of the world. Say, India, of many countries within Africa, the Middle East, or even our service members within the military, don't have technologies designed for lower resource settings. And that's the formation of Sisu. We designed a technology that is simple, it's handheld, it can be used anywhere there's a surgeon, and simply if there's a pool of blood internally, there's a little bit of blood-like imagery here, I think there's a lot of medical folks, where we designed a product that simply if blood is pooled internally, you can insert the tip of the device in, and then when you pull a handle up, blood is pulled in through a filter. It's transferred directly to a blood bag to be retransfused immediately in the same surgery. So really combining the safety of what's being done in the United States with the simplicity and the innovation that inspired us from emerging markets. And this simple product is a major opportunity. We've designed a product that has a $2 billion opportunity. There's 20 million cases viable for auto transfusion each year. And it's something that's already been established. So this company was founded in 2014. And we've raised $4.3 million of investment to create a product that has established value. We've actually been being used and actively saving lives. I have stories that come in. I'll share a couple of those with all of you. We've had strong growth, and I'll walk you through some of those numbers just very briefly. We have both US FDA clearance and regulatory clearance in several key markets, achieving our US FDA clearance just a few months ago, several patents, established margins, and traction on a national policy level in several countries. And this, for what we've done, just to bring this home a little bit, these are just a couple of our clinicians talking about our product, on how Hemofuse is providing blood access every day to clinicians and to patients around the globe to give them their own blood back. And it's something where in this business, it's not only about the product, it's also the business model, as I highlighted before. So how do we create something that's a great technology, but also creates value not only for CSU, but for our distributor that we sell to, for the hospital that also is in the business of making lives, and finally on to the end patient to make sure that we're overall reducing healthcare system cost. And what I'm most proud about is our ability to bring this technology and increase the revenue. This is just the case study within Kenya. We have $955,000 in revenue as a company, and this is a portion from within Kenya. And we're focused on scaling this with our US FDA clearance in hand from Kenya to 4 other distributors in negotiation into 8 new countries in the next 6 months, ultimately leading to a potential to reach our goal is at least 4,500 hospitals over the next 5 years and achieving $63 million in revenue. So I go through all of this of kind of painting that picture of our vision and our future, but the core of what I want to talk about here is also about CSUs and my own personal past of how I got there here. So we have great recognition and great awards. We have a great team, but getting to this point and the success that we have hasn't really been easy. There hasn't been a single solution or a single silver bullet to get us to this spot. And ultimately, we know that achieving our full vision of changing the way that medical devices are designed and commercialized for emerging markets also is a multifaceted process that involves not only our company, but also other organizations, other strategic partners, and other further growth as well. So I'm going to rewind this just a little bit and talk about my past. So now you know where we've come. I gave you a little bit of the starting point, going back to my entrepreneurial journey at the University of Michigan. And if I go back a little further, I should mention that I'm originally a sheep farmer from the Upper Peninsula of Michigan. In regards to entrepreneurship, each stage has required that willingness to adapt and that stubborn unwillingness to give up, and that CSU. So my first company, I actually want to ask you a couple questions while I'm doing this, is that I founded a company focused right out of college on an organization working with rural mobile clinics in India, designing similarly medical devices. And I'm an engineer by training. When you see the equivalent of duct tape and super glue, you know you have a real problem. And that is the case in the medical device sector as well. My first product that I created was a centrifuge to separate blood for purposes of testing made out of bicycle parts. Who thinks a product that's made out of locally available materials out of a bicycle to separate blood is a good idea? I'll tell you now, it's a terrible idea. So this was my first company, my first idea out of my engineering project. The idea that as an engineer, that if something functions, if it works, that's all you need, right? If you build it, the silver bullet is that if there's just these plans of, clinicians in rural India where I had never been before, we're able to have a readily available product that it would work. Now, I've learned since of my own bias and other components of terms like white savior and things I need to reckon with as well, of that, it's not just about the product. You have to create a product that actually is working with who you're serving, of who you're selling the product to, that's creating value, because why is a bicycle-based centrifuge a bad idea? Well, first off, bicycles are really valuable. They're designed to function in a certain way, and if you chop something up that's perfectly good, and then you make it into something else, that's a lot more expensive than designing something from the ground up. Further, medical device, you need standardization. You need to have a product that can be repetitive. And another piece is that the component of this where you have to think about of what does it look like? If you have a loved one who's in a medical center and you have something that looks janky, are you going to trust the results of what it looks like? No. So all of those components coming in through that journey of realizing, okay, of working with clinicians in rural India, of finding those NGOs and those different partners, really of taking a step back and saying, okay, the idea here is good. We got it from a survey of clinicians across the globe of what was needed, a centrifuge that works without electricity, but this solution wasn't great. And I'll also note, if you see solutions on the globe of simple things, if it's gonna save the world, if it's this great idea, and if you look back 10 years later, it probably hasn't, because it's not that simple. So we went back to the drawing board and kind of on a centrifuge of 3D printing, as you heard up from early ideas here, through different prototypes and local machine shops, of even prototypes of at the University of Michigan resources, or out of Grand Rapids, out of the Geek group that was there, to create different prototypes, iterate those with our customers, and make sure that we were creating value. And that first company I created was a nonprofit. And so again, I created a nonprofit, but ultimately became disillusioned with that model for the specific space we were in, because we needed to invest in a high R&D space in order to create a product, and wanted to make sure that we were designing for our customers and towards those end users. And so that was really the creation from this student project turned nonprofit, turned me moving into India to work with a connection of a connection who said that if I showed up on their doorstep, they would give me free prototyping support on our product, which they did when I came over to India. Because when people offer, often they mean it. You just have to follow up, and you have to take that onus to take that leap yourself. And so all that at the end, realized that it wasn't enough. And so that was the formation of Sisu Global in partnership with my two women co-founders, and especially my friend and my co-founder, Jillian. She had previously founded a medical device design firm focused on Ghana. And she also realized that similarly, the medical device design is great, but you need to create a business to get it out into the world. You need to raise investment, and you can't bootstrap a medical device company, because you need to do testing and you need to make sure that it's safe. And so together, that was the formation of founding Sisu. And ultimately, and kind of also the end of CentriCycle. And so over this, of a couple just points to hit on here, is that what I learned is that the component of this, and I talked a lot about me, right? But behind the scenes, I wouldn't be here without my team. And not only my team, my mentors, who I sat down with once a month. Sandra was one of those, and we were in Grand Rapids, Michigan, of the tenacity and that Sisu to keep going. Understanding that the product is important, but the business model is equally, if not more so, important to make sure it's creating value across each stage of the supply chain. Realizing that perception matters. I didn't get into that, but you can imagine I'm a white woman selling medical devices in Africa, and the women, you heard the statistic of don't raise about 2.7% of the total venture capital. And there's a lot of components here of where the perception of what we're doing can be more challenging, and even more so for some of my peers. And then finally, it's the execution of making sure that even if maybe you don't have the same opportunities or raising things, but just making sure you get things done, move things forward and have that progress. And finally, at the end of this is recognizing the value of both money and of time. In the intersection of these are the two most important kind of elements behind everything to make things move forward. So finally on this, I want to just summarize that of the lessons learned, of recognizing that you heard these different stages that I went through, of these failures, of these successes, to get to the point where we are now. And ultimately, it is a journey to get through these different steps. And the other lesson learned, I talked about this, of kind of the underpinning is that team and that network, both as an individual and as a company, for who you're surrounding yourself with and what opportunities you're seizing. And kind of the core of this is that there is no simple answer, there is no silver bullet. It's the ultimate of when you fail, of picking yourself back up, of trying again, not keeping on doing the same thing, but ultimately iterating, trying something different to find that pathway that leads to success. And so, with that, as I hope that's something you take with you in those stages of entrepreneurs that are in the room, for however that each of you define this, and continue to take that core of Sisu that I know is in each of you in order to achieve success. So with that, is there a space for some questions?
Yes.
Great. Yes.
So when I was starting the idea or thinking of my business, I was trying to look and see, okay, so how can I hedge my odds? How can I do it so that I succeed? And everything I read referred to not being cool or skinny or beautiful or have loads of money. The only thing that separates a business from succeeding and not succeeding is this. And it's really hanging in there when everybody else has let go. And I wanted to share that. I was talking with my neighbor upstairs today who was kind of losing hope in his business and everything, and I told him the same thing, you gotta keep going. You gotta keep going, even though you feel like throwing the towel in, and every day, I'm sure you have many days that you feel like throwing the towel in and saying, okay, I'm gonna retire and go in my RV and go across the country. But it is that persevering and hanging in there and not losing hope, and continuing to work through everything, even though it looks hopeless some days. So thank you for sharing your presentation, and I 100% agree with what you have, and especially this saying that you have. Thank you.
Thank you. I appreciate that. Yeah?
One of our presentations today was talking about gender bias.
Yep.
And I just wonder, could you share a personal story where maybe you overcome this in your...
Yeah, absolutely. I think for any of us here, of gender bias, of intersectionality as well, is something that is very prevalent in this space and kind of in venture capital. And I think that there's different components, right? It makes it more difficult, candidly, in terms of becoming success. And it's one of the reasons why I do speeches and presentations, of making sure to be a representation of a female CEO and a female entrepreneur. Anything you do, there will be people who say things, and most of the time it's not something that's up front and center, but more of the studies that exist on, as a female, you have to be prepared to receive negative framed questions. So if any of you haven't seen the TED Talk or those conversations of, they've done reviews on panels from some of the accelerator programs where women get negative frame questions or risk frame questions, where men typically get opportunity framed questions. So, for CSU, of questions on, well, how are you going to handle regulatory? That seems really hard, rather than, wow, like how big could you make this opportunity? So the answer, what I've intentionally done is to reframe in terms of, well, regulatory actually is an opportunity in that it can create a broader barrier. And once we work ourselves into national policy with our partner, like AMREF, who's the largest Africa-based healthcare NGO, that will actually prevent others from taking our market share, and we'll grow faster, right? Or things I've curated, like how I look, in terms of wearing like a blazer, and I've sort of curated a look and an image to sort of counteract where I know those biases are, and to also, in my deck of this has more things that are a little bit more fluffy. But when I talk to investors, I know that bias being, especially when I started, a younger woman, I know that they were going to assume that I was just out to, have impact only, and that I was basically an NGO in disguise. And so leaned into the numbers to kind of counteract that and kind of say, like, no, I'm not a social venture. This will make money. And it's more of navigating and understanding, like, okay, these biases exist, you can't get around that, but how can I play in this space, and how can I help support the ecosystem to help and make introductions and do the steps and know who are the good connections and the good investors to connect my fellow peers and lean into that network to be connected and help bring the ecosystem up. Does that answer your question?
I think you're such a shining example of how when you represent the highest good, even though you're existing in a dysfunctional medical system that desperately needs reform, you are being successful. Bravo.
Thank you. Yeah, at the top.
Well, congratulations on raising the $4.3 million, I think.
Thank you.
That's number. A lot of startups have difficulty raising that early stage capital.
Yeah.
I'm curious as to how you went about doing that, and whether maybe you availed yourself of any NCIR and CPR programs. This might be a good candidate for that. So anyway, you can just tell us a little bit of the story of how you secured that early stage seed funding.
Yeah, absolutely. So in terms of our funding landscape and our funding history, is we really worked our way up. So when you talk about opportunities and biases that exist as well, is that one thing we were really good at an early stage was winning awards for what we were doing and getting a lot of press. So when we first started, bootstrapped. I worked actually doing oil chemical consulting on the side. My co-founder CTO did AutoCAD work, and my other co-founder did copy editing to support what we were doing. And we were fortunate enough to have the means to be able to kind of support what this vision was. Then we won these prize winnings of 10,000 here or there, things like Entrepreneurial Journey from Michigan Women Forward through different programs. And kind of our big break was a USAID grant. Then we also worked up to an accelerator program about a year after we founded, getting $50,000 and connecting us with Johns Hopkins University, which is why we moved from Michigan out to Baltimore. And then we got Maryland funding of $100,000 of check in 2016 was our first meaningful funding. And then we have kind of worked up from there of our seed round of, raising just shy of $1 million of funding. And then we've gone through a couple subsequent rounds since, kind of 4 different key points, and making sure that, each time we raised had a specific ask and a specific milestone jumping us forward, and not, jumping all the end, but kind of what is that next tangible milestone we need, making sure our investors were updated so that they reinvested in us. And also that move to Baltimore, candidly, for what we did was really great for us it gave us a chance to reinvent ourselves and kind of our image there from everything we learned from our roots here in Grand Rapids. But to kind of give us that space. And also when you move into a new city, sometimes you're new and shiny, and that helps in terms of, you know, moving specifically to somewhere to get that ownership and that buy-in and that kickstart towards building, you know, our funding and our ecosystem. But no SBIR or STTR at this point, although those are really great resources that do exist. And I'm sure that the SBA helps with that sort of thing in different applications as well.
So, I am currently 17 years old.
Mm-hmm.
I'm here because of my mother. She's one of the teachers in it. But I currently don't know exactly what I want to go into. I mean, I have a general idea, but I'm currently applying to colleges and senior in high school.
Yeah.
And I guess what I want to know is if you could give, or if you could have gotten one piece of advice at my age, what would you want to do? Or at now?
Yeah. So when I was 17, I did an exchange program. I knew I wanted to be an eye surgeon, and then I wanted to be an artist, and then I wanted to, so very much in sort of that space. But one of the things within college that was great was kind of getting that chance to try out, and kind of my classes are what inspired me, right? I did engineering, and I picked chemical engineering because I'm like, this is a decision not to make a decision right now, because there's a lot of different paths that it can take. And those classes inspired me. My freshman engineering class is what turned into my first company. So I think the advice that I would have is that, you know, of stay open-minded and you'll find that thing that hooks you, that, you know, might not be easy, but that is interesting and engaging. And if you just don't stick with something that doesn't excite you, try a whole lot of different things. I think is there one more?
I didn't miss this, I'm sorry, I got off on it, but where is your business now?
Where are we based?
No, where are you in the process now?
So we are we're post-commercial, so we're scaling. So we've been selling mainly within Kenya. We're scaling to additional countries. So with our US FDA clearance, we're in negotiations with regional and kind of global distributors to take our technology that's proven, has been, you know, we have nearly $1 million of revenue in our lifetime, and working on scaling up the commercial sales. Does that answer the question? And we're Baltimore based, but we have a global team. So we have team members in Kenya, Ghana, the UK, and India. So I didn't whiz through my management team, but our COO is based in India as well. Great. Well, yeah. So the device is equal to the cost of 2 blood bags per surgery. So, and we salvaged the average based on a study we did of about 100 surgeries. We capture 2 units of blood per surgery and retransfuse it back to the patient. So making it about equivalent to the cost of blood, ignoring certain countries that subsidize, but that's the cost of testing it to make sure it's safe.
I have a question. So how did you wind up going to India and Africa and all of that? I know it was never a consideration when I was starting my business.
Yeah, so well, one thing I would say is in starting a business, if I were to recommend it, I wouldn't necessarily recommend of starting business internationally, because I think it's most powerful to start a business kind of close to home in the communities of which you're in, where you really understand that opportunity, that challenge, and that's, you know, what I look to the future is well of. But for me, I did, right out of high school, actually, I did an exchange program with Rotary. And I lived for a year in Turkey. That's why I speak Turkish. So out of my sheep farm in rural Michigan, the Upper Peninsula, I went and I lived for a year with a Turkish family that didn't speak any English through this exchange program by my Rotary Club that is open to actually if you're 17, I went before I was 18 is kind of the cutoff for that program. And then when I went to India, that was more of by nature of my freshman engineering project. We partnered with a club called Michigan Health Engineered for All Lives, or MHEAL. And so they had sent this survey out to different clinics across the globe asking for what are the needs, and what came back was a manual centrifuge that operated without electricity. So we created this device, and then we wanted to, out of bicycles, we wanted to test it. And so we partnered with the University of Michigan. There was a group that was tied in with a rural of healthcare, rural mobile clinic set up in India. So through the University of Michigan, that kind of brought that to India. And then, pursuing that, I worked for a company in India, did an internship kind of through a fellowship at the University of Michigan, again, leveraging those resources, which is where I met our COO when I worked for that same company and sucked him into our company for a 6-month project that was 5 years ago. So basically just seizing those opportunities and resources that I'm sure Western Michigan has as well, and kind of that exist for students who are excited about seeing more about the world. Yep. And I'm fortunate to get these fellowships and programs and things to help pay for such opportunities as well.
Thank you, Carolyn.
Great, thanks.